we should be live. Yes, we are live on Facebook, just setting up the things. Let the Facebook load, and I just have to set up some stuff. Okay, yeah. So good evening, everybody. Very quickly, you know, I was missing for 15 days, and now suddenly, very quickly, I'm doing 2 interviews a day. You know that I don't give up, and this is happening. All the 100 moms are going to be interviewed, no matter what stops me from doing it. So I have a beautiful mom here with a very inspiring story, and the reason she's here is that she'll definitely inspire the mother pulse that I'm talking about. The fact that you know, when somebody aligns herself with the mother pulse, things have to work. Like, that is it. That's what happens. So welcome, Dr. Sara, and it's a pleasure having you here. Please go ahead and introduce yourself, because I always say the mother who lives the story tells the story the best. But before you get on to your mother story, let's hear a little about who you are, what do you do, and what's your present thing, and then we'll go on to your mother journey. And I would love you to also tell about your mother, because that itself is a separate inspiring story altogether.
Sure. Yeah. Thank you very much, Shikha. That's lovely. You are an amazing mother. I can see that because of all that, like, you know, the crisis you had for last 15 days and then bouncing back to work is amazing.
I have a bigger mission here to raise, you know, the awareness that a mom can bounce back no matter what. So that mission has been handed over to me, and I have to be true to that. So yes, I'm back. 15 days break, but I'm back.
Your word mother pulse has you know, literally influenced me a lot, and I've like literally started comparing certain things with that. I mean, that's an amazing thing that you told me yesterday. I was like so touched by it.
Yes.
Anyways,
just to before we start, and I just want everybody to know that every time you go down and you close your eyes and you say, what will the mother pulse, what will the mother pulse do? And she will just know the answer. So that's what my discoveries, that's what my work is going to be going ahead, to keep getting that mother pulse out in awareness again.
Exactly.
So go ahead.
Okay. Yeah, I'm Dr. Sara Ha. I mean, professionally, I'm a dentist. I've been a dentist for almost quite a long time now. I've worked as a senior lecturer and a consultant in a very reputed dental school. And it was like around 13 and a half years of journey. And after that, it was like, you know, you would always want to grow. I never wanted to do my master's in dentistry because I was never that keen on it. And I was always like, you know, more towards doing certain things, which I actually wanted to become an MBBS doctor. But then certain circumstances, I finally had to settle with dentistry, but I'm really happy. I was telling you, Shikha, the other day that we are people who are, you know, in beautiful conversations with helplessly mute people. And then, you know, you have to bring smiles either on the chair or off the chair. So yes, I'm a dentist, a healthcare professional. The last 1.5 years, since the time the pandemic raged and we had this, like, you know, it was like widespread here in India, I've been working as a COVID duty doctor as well in a couple of centers. And that was an amazing and a very gratifying experience that I can never ever forget. I'm really grateful to Almighty that He gave me this opportunity to serve people in such a crisis. We never ever in our dreams thought that we would ever face a pandemic. Right. And that has been a wonderful experience. Besides that, I have been running an NGO, very subtle, very low profile, but we've done a lot of social service. We've gone across Karnataka, we've done camps, we've done eye camps, we've got surgeries done from our NGO. We are a like, you know, what do you say, self-involved group kind of a thing, wherein we are a group of members who, like, you know, contribute to it and we take things ahead. And I will come to it later on when I conclude my story. I will tell you about the mental health aspect also. But yes, I do work for mental health, child abuse, then domestic violence. All these things have been like, you know, a forte wherein I have literally wanted to be a part of it. So I've attended a lot of conferences as speaker for mental health, child abuse and neglect, and so on. So this is a short story, introduction, sorry. And as of now, trying to set some global footprints in countries which are upcoming now and they lack medical care, dental care. and to cover it up, I can say healthcare, and they vouch on Indian doctors. So wherever I can represent myself as a proud Indian, okay, with our services or whatever, so we are like, venturing into that. So I would want all of them to like wish us luck so that we as a team can do a lot.
That's beautiful. That's beautiful. There is a lot of luck for you for sure. Moving on, like when I started speaking to you and we discussed your mom, and she like her story is so inspiring, standalone, apart from your story as a mom. And I definitely want people to know that that's the ripple effect I'm talking about. When the mother aligns herself with the mother pulse, she ripples down a very strong generation ahead, and that's where my work will keep going ahead. And every time I see a very strong mother, I always ask them how their mother was. And before I could ask you, you already mentioned. So let's celebrate her today. I know she's no more, but let's celebrate her and who she was and how she influenced you as a child. And then we move on to you influencing your daughter.
Yeah, my mom, oh my God, I don't know. People say that they used to wonder of what mud she's made up of or what soil she's made up of. And ultimately, my aunt concluded, like I told you the other day, yeah, she was made up of soil from Mecca. That's why she's resting in peace there. Mama was a daughter, a very proud daughter of a very renewed politician here. And also, grandpa was a very good, very famous social like in socially involved person. I would say social service is an understatement for him. He was an MLC twice, and then he also was the Waqf board chairman. So Mama was always proud of her father, and she would always hold her head high. And my grandfather gave a lot of importance to education. He saw to it that all his daughters got educated. Everybody are postgraduates. Mama did her BSc, then she did her MA in Middle Eastern studies. She got a rank, she got a gold medal. And then she did her B.Ed and she joined school as a teacher. That's
just wanting to have people perspective, because people like see from all over the world. So what year do you think your mom graduated?
Mama's graduation, I think it was like maybe 1970.
Right.
1970, and then 1973, 1972, she had her post-graduation, and then she joined the school. Yeah. The issue with Mama was Mama had leukoderma, and she had decided she's not going to get married to anybody. So she was almost 29, 30 years old when Dad proposed her. Dad was 7 years younger to Mama, and he had finished his graduation and joined the same school to just get some experience because it was his aunt's school. And he liked Mama and he proposed her and he convinced her, and then they got married. So Mama was like, Shikha, she had leukoderma. Sometimes her skin would be totally white. Sometimes it would be brown and white and whatever. But then I have never seen her lose her smile on her face or feel sad about it or feel, see, those were the days like 1977, Mama got married. Okay. So those were the times that people had a very different, mindset, how you relate. Today, there are so many things which can cover up a lot of issues. It can cover up your, can add a lot. But then at those times, it was like, the kind of society that my mother had faced was like, definitely she had a lot of issues, and she started her treatment wherein she would apply some creams and all, and then literally her skin would peel off, and then she said, whatever is there, this is natural, so let me adjust with it. And she threw all the medicines and she continued her life. One thing she saw to it, she faced it bravely. She was very brave to face it. She was never ashamed, never, never conscious about it. She was very proud of her skin, of her, and she was very proud of her family background. She was very proud of her education. So one thing was like, she saw to it that her children did not face anything like that. And so she never allowed us into the kitchen, never. And then, yes, she was definitely...
Why do you think the kitchen would cause any problem?
Mama was scared of burns. And then she thought if there is a burn injury or something that our children would have, like especially burns, she kept us away from the stuff. So until, we started going to college, she never allowed us into the kitchen. We were just, asked to go serve the dishes and help out, but we were never, ever allowed to light the stove. So that was one thing that she protected. I mean, as a mother, maybe she had that fear. But then later on, after that, like, when I got married and I started cooking, it was mama who used to help me out and tell me, tell me the recipes over the phone, and she helped me out. So she came out of that fear as well. But yes, definitely she really fought it hard. Because of all that, she also had ulcerative colitis for almost 20 years, and she literally battled with that disease for quite some time. And she used to frequently visit Bangalore and see her doctor. And then ultimately, when she finished her work, the thing is, when she got retired, she decided she'll go for pilgrimage, because she was like, I have to go to pilgrimage, and this my very own earn money, because this is the gratitude that I have to show to Almighty for. Because she was a gazetted officer, like she retired as a gazetted officer. So she decided she will travel. And fortunately, she was in best of her health when she went. The doctors and all gave her permission. But 17 days after her departure, all of a sudden she expired. She just landed up with massive pulmonary edema, and within 12 hours she was no more.
Wow. That's what it is. Like, just that story itself should be written sometimes, as a separate book, because one, she was just way ahead of her time to get married to somebody younger in India 50 years back, to get married to somebody younger. Your dad was way ahead of his time to, have no issues with marrying somebody older to her, and somebody who's fighting with leukodemia, which could have been a very big social taboo, in India for sure, 50 years back. So both your parents were way ahead of their time, and they were into education, and your grandfather was way ahead of his time. To, I think, when your mother was younger, it was almost 70 years back or 80 years back probably, and to let her follow her dream and to make all her daughters study till the end, in itself shows a great legacy that you all are following. And that's the ripple effect I'm talking about. That's a ripple effect. So as a positive ripple effect happens, a negative ripple effect happens in a similar way. So generations after generations after generations, this whole concept of the negative ripple effect also happens, and we don't understand it, that it's coming sometimes down as passing, and that's why we need to stop it as moms now, if we are in any way passing unknowingly any kind of negative ripple down to the coming generation. She's amazing, and what a story that she went to Mecca, and she's buried there, and nobody knew that. Like, that was her.
We daughters didn't even get a chance to see her. And you would be surprised. I was very scared. I was very apprehensive when she decided to travel. She wanted to take up this pilgrimage. I was very scared. And she said, being a doctor, you're scared. Don't you trust medicines? I said, it's not that. You're so innocent. You're so humble. You're so nice. I'm very scared that God might, reward you with a place there. These were my words. And I had that fear that I would lose her. And that's what exactly happened. But we take it as a blessing, because she's placed in a very sacred place. Maybe she deserved it. That's something that you're supposed to convince yourself. We were quite young when we lost our mother. Like, I was hardly 25 or 26. My sister was just 22, and we had one child each. And they're just growing up, and it was very difficult for us to understand. Even today, we haven't seen her go. We haven't you literally haven't performed any rituals or anything as such. So the pain is like, sometimes I feel, Shikha, if I go back to, when I go to Mecca, I haven't yet been to Mecca, maybe I'll find her. These are the things that, come to our mind. Though we are like so educated, we know the reality, but these are the inner feelings that come out.
Keertana is here and joining. Keertana, what an inspiring story of her mother. And then you wait here and listen to her story, because something even more inspiring is coming, and that's what I'm talking about. And I definitely celebrate your mother, Sarah. Like, I don't know, with your story, I just feel like meeting a person like her, who can stand like that, who can command. And I know you told me that when you died, many people came, and there was a lot of social work that she had done that you were not even aware of. You were
Yes,
not even aware of.
absolutely.
And that's the kind of love she had collected, not even telling people about it. So that itself is a separate story. And I told you, if she was alive, I would have definitely taken her on an interview to definitely honor her as a mom. But let's go on to you as a journey and you as a mom before we move forward.
My journey also has a connection with mom, because the last when she was very fine. Just 2 days before her death, she called me from the main mosque. Okay, she called me from the Mecca mosque, and she said, I mean, she was reading Quran, and I called her, and she said, I was just remembering you. I said, why? She said, I've prayed for another daughter for you. So I said, Mama, the one you've left here itself, she herself is like missing you so much. You please come back and take care of her. I don't want another child so soon. She said, no, no, you will have another child soon. I have prayed for her. And we were very particular about names, you know, me, Mama, my sister, Aisha. We have always been very particular about names having meaning, and, you know, names. We always had this connect with Urdu novels. Mama was very good in Urdu. And she inspired me to learn the purest form of Urdu, so I can talk that Urdu as well, the Lucknowi Urdu, what we say. So she was like, you know, she even named the child. She said, we will name her Zara. And I was like, okay, fine, definitely. You come back and we will think about it. And then Mama never came back, and within 3 months I conceived. And then January, we lost Mama in December, and January I gave birth to Zoya. It was a very difficult pregnancy because mom was not around. Second, I'm married to my cousin. And the first pregnancy was fine. We were a little scared that, you know, we might have some congenital issues and all that, because I was married to my first cousin. And then the second one, I was a little concerned because in 5th month of my pregnancy, I was diagnosed with polyhydramnios, that is excessive liquor. So in 5th, 6th month, you attain your 9-month size, and there is too much of liquor. So your 9-month size is attained in 5th and 6th month. And after that, it was like, you know, next 3 months, it was like 9 months for me. I was not able to walk properly. I was not able to sleep properly. It was a huge tummy. And the other things, being a doctor, I was a little concerned about infections. You know, infections inside the womb and all that, but fortunately things went smoothly. I have my husband was very supportive, because we had just recently lost Mama, and then I got that care. My sister moved from Udupi. She came here to take care of me, and then I delivered Zoya on an emergency because I had started leaking, and it was an emergency surgery which was decided in 2 hours. And then this beautiful child with a lot of hair, fair, and everybody, the moment they saw her, this lower part resembled Mama, and they were like, oh my God, she resembles Nuzhat Appa. Her name was, Mama's name was Sayada Nuzhat Afza. So everyone was like, oh my God, she resembles Nuzhat Appa. And then I brought her home. She was 3.5 kilos. And my gynec, Dr. Gayatri, who was a family gynecologist, took very good care of me. And I brought her home. And then within 7-8 days, I started seeing that she was losing weight. All the water was gone. And it's very normal for children to lose 200 grams of weight or 300 grams of weight. But Zoya had almost lost. My daughter's name is Zoya. I'll tell you the story about that as well. So Zoya had lost almost 1 kilo. And then I was very shocked. Then I went to the doctor and I said, this child is losing weight badly. So it was her 16th day, and the doctor sent us for some investigations and all. And by the time the investigations were out, she was diagnosed with a severe urinary tract infections with changes in renal parameters. Her creatinine level was high. So she had to be hospitalized, and then she was given very, very strong antibiotics. It was 3 doses a day, and everything was IV. And then this child had no, no water, in the sense she was so skinny. So every day the one IV cannula would go, and then it would come out, and they would search places for her for recannulation. And then luckily she improved. She improved, all her parameters settled, and 30th day she was discharged, 30th day of her life. But then I was warned to keep a watch on her. So every second, third day, Shekha, this was the most difficult time for me, because there is something called as mini-com, wherein, you know, you get a plastic which you have to put it on the pubic area of the child, and you try to collect the urine, and the child would not pass urine. The moment you remove Unicon, the urine is passed in the pamper, but not in the mini-com. So these things were like, you know, at that time it was very, very difficult. Somehow I used to collect and go in for a investigation and check for microscopy, because they did not want this infection to come back. So next 2-3 months, it was like every day run to the pathology lab. And then slightly some improvement in weight I saw, not much improvement. She would literally look like a monkey's baby, you know, that much of weight loss she had. And post antibiotic also, she had a lot of issues. So 4th month, I noticed that when I was feeding my child, usually children have eye contact with their mothers when the mothers are feeding, and that starts almost 2nd month. But I was not able to establish that eye contact with my child, and there was no social smile. And that is where it was like an alarm in my head, and I ran to my pediatrician. The same day, I was scared that she might be blind. That was my fear. And the same day, the pediatrician sent me for a CT scan. We got the CT scan and my world collapsed that day because the CT showed she had an underdeveloped brain. It was diagnosed as cerebral atrophy. And it was also like related to my polyhydramnios, and maybe also the fact that it was a first relation with congenital defect or abnormality, whatever. And the same evening, I was called again in the hospital and counseled for an hour, wherein they made me realize it's like the whole world coming down, crashing down, wherein I was literally prepared and counseled that you have a child who's definitely going to be abnormal and who's definitely going to be special, and you will have to adjust. Now it is not going to be the same lifestyle. You have to change. Wherever you go, you will have to have some help, or you have to totally dedicate your life to your child. And then I was referred to Parijima Neuro Rehabilitation Center in Bangalore, Dr. Suresh Arun, wherein they said like she will need a lot of therapy because there were absolutely no reflexes. When you see the children, I mean, you give them the hand, they try to pull, and then there are certain reflexes. You just try to, like, you would have seen, like, the children, if they find something which is like, hard, they just push and they move behind. So these were the normal reflexes which were missing. And this was very alarming for us. Then I went to Parijman Neuro Rehabilitation Center. An EEG was done, and then the doctor said, she definitely has an issue and she might be a spastic child. They were suspecting cerebral palsy, and she might even have a mental retardation. So again, I was counseled, but then they had advised occupational therapy, strict occupational therapy, and a lot of medications. Lot of medications for Zoya, for her improvement, for her health, her, all multivitamins, and then carnitines, all these things were like prescribed. Then I came back, I started taking her to the therapy, decided, okay, there is nothing like, you have to do now. The thing is, when I was sitting in the neuro rehabilitation center, we saw an autistic child who was not at all in control of his father. So I was observing the child, and I just passed a comment in front of my husband saying that how unfortunate that father is. My husband just gave me a stare and he said, I don't expect this from you. Why is the father unfortunate? In fact, he's the best blessed father on this planet. And I was like, why? He said, Sarah, it's usually what happens is, at one stage, when children come to one stage, we always want those children, like, to come up in life, grow up, and then, stand on their feet and then take care of the parents. It is not the same here. In this case, that father will be serving this child until he dies. So imagine when he goes to the heavens, what would he be carrying? How well he would be received. So he is definitely going to commit his life throughout for this child. So this is the thing that my husband said, and that really changed my mentality. And I was like, oh my God, what was I talking? What was I even thinking? And that's when I decided, okay, whatever it is, even if she's spastic, even if she's blind, whatever she is my child, and I'm going to take care of her. And Mama had said, like, you will have a second child. So yes, she's Mama's gift to me. So I want this child. So that I made up my mind, whether she's blind, whether she's spastic, whatever it is, I want this child alive. I cannot let her go. So whatever is possible, let me do this for her. And we both of them, my husband has been a massive, massive support for me. So we started working, and we went to JSS Pari Rehabilitation Center, and then we went to Occupational Therapy Center. I still remember, and I owe so much to Shashikala Ramanathan, madam. And she was like, ultimate. The moment she saw Zoya, she was very upset, being a doctor's daughter and in such condition. She just got up, she hugged me, and she said, let's do our best. I'm here with you. Let's do our best, but I'm with you. So just be strong to face whatever. So we started the occupational therapy, wherein they used to tie her to a ball. They put her to a ball, tie her on a prone board for hours together, and make her do certain activities. Occupational therapy is very different from physiotherapy. Physiotherapy is working on already present muscles, okay, and then improving the condition. Occupational therapy is you create these reflexes. You have to bring in those reflexes. So occupational therapy is to literally introduce what is normal, okay, what is normal. So that has to be introduced. So Zoya would be tied to chairs. Zoya would be tied to balls. She would be put on the balls. She got head control when she was 9 months old. And then dedicatedly, I used to take her. My husband also used to come along, and sometimes he would drop us and go, and I used to go finish off the occupational therapy and her. Meanwhile, during this time, the other biggest challenge was, since her muscles were not developed, she was a very lean child. Again, immunity was not that great. She landed up with life-threatening pneumonias. 6 hospitalizations to sum it up. And the same time, because of her pneumonias and high fever, she even developed febrile seizures. So that was another thing. We were in occupational therapy one day. She just fainted, she just fainted. And I was like, what is happening? And then I saw the seizure. So I was like, okay, challenge after challenge. We have to take her to the hospital, 15 days of hospitalization, small beds. You don't know what your child is. At one point, she was so critical. Her saturation was 70, 74. And they were like, okay, there is a ventilator bed ready in Jesus. One child is very critical. The moment he passes away, your child will be shifted. And I was like, no, I don't want that child to pass away. I don't want my child to go into that ventilator. So I have witnessed a miracle that night in the hospital, wherein all of a sudden, they say, as much as you are positive or whatever, the doctor came and asked me, okay, that was my third hospitalization in like almost every month, June, July, and August. So this happened in August. And then he said, like, ma'am, say something. You have been silent, August 2008. And I was like, whatsoever, Ravi, I just want my child alive. Okay, whatever she is, I just want my child alive, and I don't want that child to die. So there were a lot of people around, everybody was there from every religion in the ICU that day. And then we started doing sponging, and then I don't know what happened, but within 15-20 minutes, Zoya's temperature came down. She opened her eyes. She was smiling. I was scared. I had not even seen her. And my maid was like, no, 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 she's smiling. Just look at her. And then the entire hospital, all the nurses came running because Zoya had not opened her eyes for 48 hours. And almost there was no hope. The doctor had, it seems the senior doctor had said, okay, we have to take care of Sarah. She will not be able to bear with the loss. And then this child was small and was smiling. And by 7:30, all the doctors came and there was a huge celebration. And this became an inspiration to me when I said, like, if she can come back from that, even this she can manage. So we started doing vigorous therapy. My husband used to literally hold her and make her do a lot of exercise at home. I used to take her to occupational therapy. And along with it, I used to also go and attend my college, my hospital, wherein my duty was there. So I had a very good maid to support. My sister was there. My family stood by me. And somehow one day, Shikha, this was amazing. I was told in occupational therapy by Shashikala ma'am, just come with your husband. I need to talk to you serious. I was so worried that day and I was like, okay, fine, I'll bring him. But that day he couldn't come. So I went and I was like, I didn't want him to hear anything. I didn't want him to feel the pain because we had almost spent 1 year, 4 months in that center. And I didn't want my husband to have a negative. I was sure he will never be negative, but somehow I didn't want him. I didn't encourage him also. I just went and then I see the physiotherapist, then the psychotherapist. All of them are there together. They're discussing something, they're writing something. And I was busy playing with Zoya and Zoya was throwing balls. And then they came and they said, Sarah, you will not be coming from next week. So that gave me a shock. And I just looked at everyone. It was like, okay, so you had told me that, I will be enrolling Zoya in Spastic Society. So that would happen at 7 years. But why are you telling me not to come now? Do you want me to go in there now? They said, no, you're not going anywhere. Your child is declared completely normal and she's out of all her problems. It is nothing but global development delay. For 1 month, we have been working to declare this. Your child has all the reflexes back. It was just that she was under a lot of stress because of the medications or whatsoever. And global developmental delay is very common. So it is a global developmental delay case. You're not going to come back here. So that was like, and then I said, ma'am, but, and they were like, no, look at her. Then they left her and she started climbing, the rods. Then they tied her, she untied herself. Then all those things, they just showed and said, Sarah, this has been happening. You have not observed. You've just been doing the duty. Do you realize that this girl has achieved everything? And Shikha, see, there are fine motor skills. Okay. And that fine motor skill is picking up something from a tweezer and then putting it into a box. So that was kind of very important, wherein they developed this fine motor skill. So that was a bigger challenge for me. And Zoya had achieved almost everything. Because all I remember her, she had crutches here, she has crutches there in the hand, everywhere. They were like, slings attached to her for almost a year. And they used to hold her and make her walk. So 6 hours, 4 hours of therapy, bringing her to do what is wanted by us. So that was a challenge. And yes, 1.5 years age, they declared her absolutely normal. They gave a letter that she can go to any normal school. And absolutely, there is no mental retardation and there is no spasticity. So this changed my life. But the other challenges were her immunity issues and her febrile seizures. She used to get seizures very commonly. Even 99 degrees of temperature would bring about a seizure. So these things went on for about 4 or 5 years. And I can tell you for last 10 years, life has been, no, last 8 years, life has been absolutely beautiful, because those 5 years, 4 to 5 years, we did not have a social life. Our entire commitment was on Zoya. There would be a time when she would have this asthma attack. She would have terrible wheezing when she had this pneumonia episodes and all that, wherein we had to give nebulization every 2 hours. So I and my husband would keep alarm. He used to get up at 2 o'clock in the night. I would get up at 4 o'clock. We used to time ourselves like that. So from all that to today, today Zoya is incredible. She's 5'7", tall. She wants to become a YouTuber. She wants to become an influencer, and I'm sure you saw her. She has a lot of interest. And the best part was, I had put her to school 1 year late. So when she went to school, a tall baby, she was never like in par with her classmates. She always had this issue, and the classmates would not relate to her. So she had very picky friends, one or two of them would care for her. And then she realized that she's getting a lot of attention from other people that she didn't want. She came and said, Mama, come and talk to the teachers. You are the PTA president. Please come and talk to the teachers. Tell them to treat me normal. I don't want any special attention. Then she would come and tell me, Mama, I want to participate in music and dance and craft, everything. And I had to use my influence, literally go request them and tell them, please let her do it. Then she became the outstanding student also in 2017. I think 2017 she became the most outstanding student, because she was multi-talented and she was there everywhere. One fine day she told me, I don't want your influence for crafts, art, or whatever. Now, school people will call me and they will tell me that Zoya, don't miss school. And I was like, what is that? I said, Mama, enroll myself in school band. So this is the smartness she plays, Shikha, this we might laugh, but behind this, there is a deep thing that the child doesn't want to be treated special. The child wants equality, and she made her point and she knows where she is. So she doesn't care for any sympathy or anything, because she says, please treat me normal. I'm normal. So this is about Zoya. Yes, it was definitely very tough. But then a lot of parents I witnessed, I was in oral medicine department. I used to see a lot of parents coming with spastic children. So that motivated me a lot. Looking at that condition, I used to show Zoya's pictures of occupational therapy, where she's tied, where she's put on the ball. And I used to show these to the patients and the parents of the patients. And I used to literally counsel them and send them to Sneha Kiran Spastic Society or JS's Occupational Therapy Center or Parijima Neuro Rehabilitation Center. And that would give me a lot of, satisfaction. And, that was a kind of gratitude. Okay, Almighty blessed me with this.
Right. It's I think there are people in the chat, and I just want everybody to send her a lot of hearts, and just a very inspiring story. And this Faida ji here, Kirtana is here, Melanie is here, Cynthia is here. And people who find the replay, please just put a lot of hearts in the comments and send it to Dr. Sarah, because this is also one of the most inspiring stories that I have heard of a mother. We've heard many inspiring stories of sports people and all kinds of stuff and what people do, but so many unheard stories of mothers have passed by, and everything just suddenly becomes vanished when things start becoming better, and that whole effort. And in your case, it's your husband as well, partnership that you have, you know, enjoyed together to be able to make this possible. So incredible. I think it's just an incredible thing. Faida is putting it, Vilma is putting a heart. It's incredible, because when the mother pulse decides that this is my kid, nobody messes with it. And then Mother Pulse is not only a human Mother Pulse, then Mother Pulse is a universal Mother Pulse. I'm saying it again and again. I'm talking about it again and again. I'm going to walk in this path again and again to prove it that every time the mother decides, nobody tells her what to do.
The thing, Shikha, that I would want to mention is 1 year of therapy. Okay, 4 months she was 4 months old when she was diagnosed. 1 year of therapy, she has achieved so much, and I was right in front. I never realized she's achieved because I had thought about the worst. They told me to bring a cerebral palsy chair. There's a special chair for the children. I brought that. They told me to bring the ball. I brought that. They told me to bring the slings. I brought that. So I was prepared for the worst. I was like, at the most, what? She will go to Spastic Society. She will spend the day. She'll come back with me. She will be with me. She will be at least trained to eat. So this was in my mind, okay? And I had gone to that level. But I never, never ever thought, okay, how would I manage and all that. I was prepared for the worst. So that's one thing I never realized when she improved, when she achieved her skills. If I have to put it, I think I will have to, if I write, I'm a writer, I do write. But if I have to put Zoya's writing every day, what and all she achieved and how she started building the blocks, and she would manage. She literally used to do, and she would point out outdoor and tell me, okay, I want to go to the swing. She was not allowed to go to the swing initially, but then when ma'am saw, okay, she's showing interest, she wants to go out, they allowed her. She started walking by herself and going to the swing, going to the seesaw. She wanted to sit there. So these are certain things I would say that, Darwin's theory literally applies in life. The child has struggled to exist. It is the survival of fittest. So she also tried a lot. She also tried a lot from herself. So this is something like, and one more thing, Shikha, a lot of people supported me, lot of people, all my colleagues. My colleague used to go to Tirupati, I don't know where all, and she would bring me that vibhuti and all that. She would say, Sara, shall I apply? I said, apply. Then my Christian friends used to bring something, and then they used to, Sara, we want to give this to Zoya. Yes, give it to her. There are a lot of prayers. My cousins were abroad, so they used to go to Mecca. They used to pray for her whenever she was in hospital, declared serious. She was declared serious 6 times. And they were like there. Okay, everybody was there. My students stood by me. A lot of students, they understood what I was going through. There was a time when I had worn 2 different kind of slippers and gone to college for work. And I had worn a ulta pajama and I had gone to work. I didn't realize. So that was the kind of pressure on me, and you have to prepare the child's food and all that. And
I just want to talk to you there. You don't need such serious situations. I have done this in spite of no serious situations. I have worn slippers which are not matching. I have worn stuff. So I'm just making you feel better. That has nothing to do only with Sara. I've done it many times just being a mom of these 2 kids and sleepless nights. I think that's what mothers do. Crazy. But what's the life force that wants to come out will come out. And for me, what I see in your story is that the life force has been very strong and it's trickling down from your grandfather to your mother, from your mother to you, because I know as a child, your sister was also not well and you took responsibility, and your parents were taking care of your sister, and you took responsibility of your grandparents, and you always are called that you're the strong one, and then you trickle down to go and put that on to Zoya and both your girls, and many fronts that are still to be discovered about you, that you have stood by with that thing. So I don't know if this kind of a person doesn't get an award by the government, who does? Like, why is a person who is like somebody like your mom, like these data points are not there on any paper, but these data points are so real. These data points are so amazing. The fact that it's just not that one grandfather of yours who decided to do something. It's so many lives, and through you so many more, and through now the stories even more people are going to get inspired. That is the ripple effect that I'm talking about. That is what I'm saying, that we have to believe that it is not a very small journey. It is not that we need to feel nice today or tomorrow or whatever, or this life. So much trickle down will happen. There's so much trickle down will happen if we live fully. If we express fully, if we live fully, the trickle will happen. You as a teacher has inspired so many people. Your mother as a teacher has inspired so many kids. So that's what it is. And I know I'm taking a journey through self-portrait. I'm taking a journey through photography. But I'm discovering that it's showing me a way that is so beautiful. And I so celebrate the fact that you as a life live this life. And today Zoya is, is a shining example that like nothing is impossible. You do not believe what the world is telling you. You believe what your heart is telling you. And when you believe what your heart is telling you, then whatever the result is, it's happening. There is no doubt it will happen. And it's been proven again and again and again and again by many people. And that's what I am also getting onto with this project, that it's a force which is existing, and we need to put this book on that force, so that the eyes go on that force, and we can acknowledge it and recognize it and respect it, and more than that, trust it, that that's the force which will guide us. Who are we to sit down and Google an encyclopedia and talk and chat and find out? Just go there, put your eye there into that force that tells you exactly what to do, and just close your eyes and follow. Just close your eyes and follow. That's what you need to do. And you've done that, and it's amazing. So hats off to you. And I just met Zoya as well, and I give her so much blessing that all of us are going to shower so much love to her, to now take it ahead, to now move forward and tell her story. You can tell your story as a mother, but she will tell her story. She will tell her story from the time she was born, and tell people that you don't give up and everything can be okay. So it's beautiful. It's beautiful. Just to move, because we have to move forward, and people see replays. So I can talk to you forever. I can talk to you forever. But
she was called Miracle Baby of JSS.
Yes, she is.
She was called Miracle Baby of JSS. And Shikha, my children gave back to me. See, during this course journey of Zoya, wherein all our concentration was on Zoya, Arusa, the elder one, suddenly became matured, suddenly became the elderly child, and she took the responsibility. She started sacrificing a lot, and my sister would take care of her. She was very close to my sister, but then she would tell my sister, no, I have to be with mama. Mama needs some help because Zoya is not well. I need to stay at home. So she started becoming that elderly child, and even today she's somebody who takes care of the house and who manages when I'm not around. And my children gave back to me, Shikha, just to run it quickly. With all the stress in life, mama's death, lot of things, my sister also during the same phase when Zoya was struggling with her health, my sister lost her son for sudden infant death syndrome, second son. He was just 7 months old. We had seen death. We had seen this much of distress. Every day it was very difficult. We would catch up only on few hours of sleep, that too on turns. So with all this, what happened was I was also working. So there was work stress, lot of stress. One fine day, I landed up in depression. That's another story. And I landed up in depression, and I knew what depression is because transient depression had happened to me when I lost my mom. But this time it was clinical depression, and I knew I am in depression. It was a very severe, very difficult time, severe anxiety, severe depression, not slept for 15 days, 20 days at a stretch, absolutely no sleep. I tried therapy, I tried counseling, I tried whatever best, but then I finally landed up with a very good doctor, Dr. Venkatesh, HS Venkatesh, who's my psychiatrist. I decided I have to take professional help. Being a doctor, I cannot do this. And then my children stood by me. Even today, I'm on the very mildest of dose. You can call it a placebo dose. I did fight the battle hard and strong. I did have relapses, but both the children took care of me. Today, I might forget, but then my children are the ones who come. They talk to each other. Have you given mama her tablet? And that tablet, that Zaptra, comes to me either through Zoya or either through Arusa. So they take care of me. They're the ones who pack all my medicines. They're the ones who get me my prescriptions. They will see everything. They will seal everything and pack whenever I travel. And my children gave back to me. They gave back to me massive.
And with your commission to inspire the world, you can go ahead and tell them that how you were saved by one of them.
Yes. So what happened was, once there was a very severe relapse. I was not knowing what to do. I was uncontrollably crying. My husband couldn't control me, and he was like, I don't understand. What's wrong with you? I said, I'm going to die. He said, you just don't have to say that, you understand what is death. Are you crazy? What are you talking? And why are you crying so uncontrolled? Because that was like, you don't realize what's happening. My heart was pounding, my heart rate was, I think, more than 130. And I had absolutely no senses. I was so scared. I was so scared because this relapse was so severe. It had been 1.5 years and I had started tapering my medicines. And that was quite early. The doctors had told me, don't do this so early, Sarah. But I knew I was happy. Let me do it. And I did that and I landed up in a mess. And then I just came, locked my husband. Luckily, my sister was at home that day. I locked my husband. I came, I sat on the dining table. There is an emergency drug which I had not used for almost a year. That was given by the doctor. It's a mouth dissolving tablet, clonazepam 0.25 mg. What I did was I opened one, took, I opened second, I took, and then I swear I don't remember. I literally swallowed all the tablets. And I was just lying on the table, and my husband by that time had called my sister who was sleeping upstairs on the first floor and said, Sarah has locked the door, just go and check what's wrong with her. And then my sister came and my elder daughter came. My sister thought it was migraine and she asked me, did you take diclofenac mouth dissolving tablet? Did you have migraine? And I was like, it seems, nodding my head and saying yes. Then my daughter, Arusa, she saw that I had taken Zappis and she screamed and said, Mama has eaten all the Zappis. There were 10 tablets and she had not touched this. Why did Zappis come out? Mama has eaten all. And then she pulled my hand, took me to the bathroom, made me vomit. She said, no, Mama, vomit, please vomit now. I remember vomiting a little bit, like, there was a pink fluid everywhere. And then I was so drowsy. Then my cousin came, my sister, they all took me to the hospital. They they admitted me. I was in the ICU for a day. The stomach wash was done. But yes, the doctor said, you are very fortunate to have a child who acted very, very, very with her presence of mind. She was very sharp to save your life. So Arusa saved my life that day.
Yeah. So that's, and we are starting the new series with even much deeper level of stories. And what can I mean? Since last 15 days pause, I'm thinking even more that like there has to be an award for, like, we are pushed down by saying you are a mother, you should do it, you are supposed to do it.
Yeah.
But there are situations that we excel all the shoulds and woulds and supposes and showed up for our children in a way that nobody can even comprehend. And these 75 stories, now 77, am I right? Yeah, 77 stories. In some or the other way are proving that again and again. And I feel very, very honored that some way universe chose me to show me this, because definitely these 75 moms are becoming a strength in me, and they are going to become the strength for many mothers, so that the generation next, so that the ripple effect, so that the stuff that's happening can stop and the positive wave can start. So thank you, I mean, for not coming here, but for being who you are, and for standing up, and for wanting to be brave enough to share your story with so many people. Not only here, you shared this story, you inspire people, you talk to so many people. Now you're working on pelvic health of women, which is your next project. And there's so much that you're already doing. You're a COVID doctor, so you've been a warrior, and I definitely need to get some kind of a shield to go and hand it over to you right now, if I can, eventually, for just honoring
you
for being this. What's your dream? Because we want to wrap up. The book is called 100 Self-Portrait, 100 Dreams. So 2 questions for you quickly before my light dies off, because my one light is dying off. One question is that in spite of being a warrior, in spite of being this not taking a no for an answer, have you showed up in pictures all the time? Have you consciously taken your own pictures? Have you celebrated yourself visually? I'm just inquisitive. That's one question. And second, what is Sarah's dream? Is where we'll wrap it up.
Yeah, after all that we went through, now I pose a lot with my children. I don't care how it is, like, We just pose, we like dressing up, we like doing makeup or no makeup or whatsoever, but we do celebrate life. I love traveling. I enjoy traveling. Traveling, in fact, healed me. This is something that I want to say before I conclude. Okay, yes, traveling, I had phobia towards travel, and I came out of that barrier. My doctor encouraged me, and he said, go. Even if you don't go, you'll die. Whether you go, you'll die. You please go. And that's when I started my journey, started traveling. Travel really healed me. And one thing, one very important thing, Shikha, is after the attempt that I did, I realized how important and how beautiful life is. I realized what would have happened to my children if I had gone, how much they needed me. And then that is what inspired me even more to, like, start working. The moment I hear somebody is in depression, most of them live in denial. I see to it whether they like it or not. I just enter, I talk to them, I start becoming their friend, and I make them understand how beautiful life is. So this is one thing. Yes, we do like celebrating our life, even smallest of the whatever, like achievements and all that. I discuss it with my children, and that makes them proud. Arusa wanted to become somebody who wanted to like into artificial intelligence, criminology, cyber security. These were things which were in her mind. And then when she saw me working for COVID, she said, no mom, I'm going to become an MBBS doctor. I said, okay. So, and again, these are the things that the children have decided for themselves. And yes, Sarah's dream is just to see her children being very, very brave, not scared of anything, standing on their feet, earning well, traveling the world, connecting to people, spreading smiles. I mean, I can spread smile via my treatment or whatever, but spreading smiles, sharing positivity as much as possible, and making people realize how beautiful this planet is, how wonderful people are, the humanity, the compassion. That is what I want my children to survive on.
That dream is already done. You should start dreaming a new dream, because that dream is done.
Yeah, my personal dream would be, okay, other than my family and all that, my personal dream would be to stand in a position, to reach a position wherein when I say something, people do value it and say, okay, she's telling it out of her experience, and they recognize it. They recognize the pain that a lady goes through. See, I'm not somebody who believes in women empowerment and all that. I find everybody equal. Men also contribute a lot to life. Maybe we regard them, or we appreciate them less. But yes, reach a place or a position wherein people understand, okay, what a woman goes through, what a lady goes through, what a mother goes through, what a sister goes through. Be at least a little bit wherein you can influence people to improve their lives.
Right.
If we can influence a little bit, remove the hate, bring about harmony, remove the despise, bring about love, compassion. If you're able to change people, their mindsets to a better world, that would be the best thing anybody would achieve. Make a difference.
Out of your two dreams, one dream is done, and that's not done by me, that's done by you, because you've already part of a very big ripple effect, and that ripple effect, by showing up for your children the way you have, you've already set them up at the right pace, and I'm sure that dream beginning has already happened. The second dream, you're here in the book, has also started. So I can see that this book will, when it comes out, is going to start many, many more dreams that are going to come through you and through the 75 moms. So I welcome you to this book, and it's a real pleasure knowing a person like you, and thank you for sharing your story, and more than that, thank you for living that story the way you did. You're a star, and just like my other moms, but you're a very, very special star for showing up the way you did and bringing up, not taking no. I know there's some is it happening in your house, or is it happening in my house?
No, it's happening in my house. My husband is at the door. 1 second. Naveed, 1 minute kholte ho?
That's okay.
It's
Go ahead.
my hubby is at the door.
Yeah, that's okay. So anyway, we are
Open the door.
My one light is gone and my second light is going to go. We will have replays. There are people who are commenting. It would be lovely for you to go back and talk to all of them. I will reply to the comments. This has been beautiful. And we go off live. Thank you everybody for the comments and all the hearts. She deserves lots of trophies, Faida ji. I think we need to be very generous in the comments with giving a lot of trophies. She definitely does. Yeah. So I'll see you around, and welcome to the book, and we will create this magic together. Yeah.
Thank you very much, Shika. And I hope, you have been a big inspiration, collecting so many people, so many stories. It's not easy. You are a mother too. And you are, again, you should be on the topmost page of your book, because it's not easy to connect to so many people, different countries, different locations, different experiences. It really takes a lot. So I'm very lucky that, I got connected to you.
It's all happening. The book is coming. We will all celebrate.
Yes, we'll celebrate.
All right. See you then.
Thank you. Thank you very much.
Stay on and I'm stopping the